Welcome to our video on nutrition, and we're looking at nutrition from infancy through adulthood today. So did you know that humans take longer to become physically mature than any other animal? We spend about 20% of our lives growing physically. So the most obvious way to measure our physical growth is measuring our size. So we measure our height, we measure our weight to see how big we are. So for example, between birth and 2 years of age, our average height increases from on average about 19 to 32 inches. And the average weight increases from about 7 pounds to about 22 pounds. Growth is very rapid from infancy to adolescence. An interesting rule of thumb is that boys achieve half of their adult height by age 2 and girls at 18 months. So if you measure your baby boy or girl at that age, you can have a rough guesstimate of what they're going to get to as far as height by the time they're fully grown. So as far as weight gain is concerned, we get a lot of fat underneath the skin during the end of the fetal growth period. So what we call the prenatal period, right before they're born. This helps the fetus, and then once they're born, it helps the baby to regulate body temperature. And we continue to accumulate this fat, which is what we would call baby fat, during the first year of life. Infants, typically, they double their birth weight by the 4th month, they triple their birth weight by the end of the first year, and more than quadruple it by 2 years. So during preschool, children become leaner typically. They're growing taller, they're not putting on as much of that fat anymore, and they're losing what we would call that baby fat. But in the elementary years, they can begin to acquire more fat. So that's not unusual somewhere around 10 years of age for them to actually have maybe this more chunky period. But you have to watch that weight and to make sure it doesn't become excessive. So as children grow, they're going to grow in what we would call growth spurts. And these growth spurts are going to have different parts of the body developing at different rates. So infants and young children are not just these little scaled down versions of adults. They kind of can be gangly, where sometimes the head and the trunk can grow faster than the legs. And so sometimes you see a child that looks a little bit top heavy compared to older children or adolescents. And one of the things you have to also know is that there are things called growing pains. And that's because bone can actually grow faster than muscle. And when that bone grows, it's kind of pulling on that muscle and can create pain in the child. Some children, and we'll talk about this, also have some pain during growth because they have vitamin deficiencies such as vitamin D. The legs and feet will catch up later in childhood, and their bodies do become more proportional as they start to reach adulthood. Today, children and adults are taller and heavier than previous generations, and that is really due to how well we take care of ourselves, our medical system, the medicines that we have, and then, of course, our improved nutrition and access to nutritional foods. And these changes from one generation to another are known as secular growth trends. Cute, huh? So does sleep impact development? And it is often taken for granted how much influence sleep has on growth. Sleep is essential for normal growth because 80% of the growth hormone is secreted while children and adolescents sleep. It's kind of interesting. I had a student several years ago who came to me and told me that he had an 8-year-old son and he was not growing. And he was about as big as a 2-year-old. And so I told him, because they'd already taken him to multiple doctors and they couldn't find anything actually physically wrong with the child. So I told him, take a video camera that has night vision and put it in your son's room. Don't let him know that you're doing it, and record him and see what's happening as far as his sleep is concerned. Well, what they were able to find was that their son did not sleep. He would be put to bed, and he was such a good little boy that he didn't make a noise. He didn't turn on the lights, but he would get out of bed, sit on the floor, and play all night long. And then he would finally fall asleep on the floor, which is where his parents would find him. And so I then recommended that they have him tested for allergies. And sure enough, they found out that he had really bad dust mite allergies. And they had to put a dust mite cover on the bed and on his pillows and take care of those allergies. And now their son was able to sleep. And they said he was growing by leaps and bounds and getting to the height that he was supposed to be at. And it was simply an allergic reaction, and he couldn't stay in that bed anymore because of those dust mite allergies. So growth hormone is secreted during sleep. Now, this is secreted by the pituitary gland, and that triggers another hormone called somatomedin. Somatomedin is the hormone that actually causes the bones and the muscles to grow. But again, if we're not sleeping like we're supposed to, we're not going to get that kind of growth. Sleep time decreases from infancy as we get older, so that roughly we need about 12 hours of sleep by the time we get to 3 years of age. And prior to that, infants can sleep even longer. At the age of 7, we need about 10 hours of sleep. But by the time we reach around the age of 12, we only need about 8 hours of sleep. Now, it's been real controversial. How much time do adults need as far as sleep is concerned? And a lot of sleep studies say that adults still require those 8 hours of sleep. However, in the teenage years, it seems that teenagers may need even more than 8 hours of sleep. They may go back to that 3-year-old need of needing around 12 hours of sleep. Sleep also affects cognitive processes. So if your child is not getting enough sleep, you're going to see issues in their life, and especially at school. So for instance, children who do not sleep well, so maybe they're waking frequently, or they have lack of consistent sleep, or maybe they just don't go to bed early enough, are often unable to pay attention in school. So these children have very poor sleeping habits. They don't do well in school, and what you see is they may even act more aggressively. As a matter of fact, some people have suggested that these children who you think might have attention deficit disorder actually don't have that. Instead, they have sleep inabilities. Because I don't know about you, but think about, I know when I don't get enough sleep, I'm doing different things like, bouncing in my chair and trying to squirm around, slap myself in the face, do different things to try to keep myself awake. Now imagine doing that when you're, I don't know, say an 8-year-old little boy, and the teacher's looking at you going, there's something wrong with this kid. And we paint them with ADD or ADHD when they're just not getting enough sleep or getting enough good sleep for some reason. So it's very important to try to make sure your child has a bedtime routine. You want them to wind down before you put them to bed, roughhousing with them, doing big activities right before bed is not going to help them, obviously, go straight to sleep. Then again, another issue is a lot of children don't go outside to play anymore. And if those kids are not active and working off all of that energy that they have, sleep isn't going to come either. So as far as fuel for growing, it's very important that the child eats appropriately. Nutrition is particularly important in the infancy stage because you have a lot of physical growth occurring, obviously. And this growth is going to require a lot of energy. So babies need to consume a lot of calories. So what's the best food for babies? Breast milk versus bottle feeding. So breast milk is best, and it ensures that babies get the nourishment that they need, especially if mom is eating appropriately, and we're going to talk about that too. Human milk contains the proper amount of carbohydrates, proteins, fats, vitamins, and minerals that the baby's going to need. So breastfeeding also has several advantages over bottle feeding, and some of those are, of course, the social interaction with the child and the mom. Breastfeeding babies also are less ill, and they are getting antibodies from mom's milk that helps them to fight off bacteria and viruses. Breast milk is always sterile and, of course, at body temperature. Breastfed babies are less prone to diarrhea, they're less prone to constipation because breast milk is a lot easier to digest. That breast milk is filled with a lot of digestive enzymes that are going to also help the baby's gastrointestinal system handle this milk. And breastfed babies adjust more rapidly to solid foods because, believe it or not, breast milk changes flavor depending on the foods that mom eats. So as she's eating these foods, baby's kind of getting a little taste of all of these foods, and they're much more likely to want to convert to the whole foods and to the different diet because of mom's breast milk. So as far as lactation, mom producing milk, these breastfeeding mothers need to choose a varied, a healthy, and a nutrient-dense diet. And remember, whatever mom is eating or drinking, it's also going to baby. So these foods need to have plenty of potential for energy for that baby. So the recommended daily allowance values suggest that we have an additional 500 calories that mom is going to eat every day. So for instance, that's about 12 to 15 grams of, that also includes 12 to 15 grams of protein that mom needs to eat as well as those additional 500 calories. So minerals, vitamins, very important that mom is consuming those, that she's taking her multivitamins, and then she's able to deliver these vitamins and minerals to the baby. And then, of course, mom, because she is producing this milk, she needs to be able to drink plenty of fluids in order to produce adequate milk. Now, the main carbohydrate you're going to find in breast milk is lactose, but there are triglycerides in that milk as well to provide energy for the baby. So, looking at human milk versus giving a child cow's milk, which is not recommended until at least after the first year of life. Human milk has more whey protein, it has less casein, which is very difficult for us to digest. It has less of the amino acid phenylalanine, which some children cannot handle digesting. And then it has more of these enzymes we call peptidases. And peptidases are enzymes that are able to pull apart proteins for those digestive purposes. Also, human milk is going to have more lipase enzymes, more linoleic acid, which we've talked about before, higher polyunsaturated to saturated fatty acid ratio, even more cholesterol, which are all necessary for that baby to grow. Now, there's going to be less calcium, less sodium, but there's a higher calcium to phosphorus ratio. More iron, more zinc are going to be available for this growing fetus. Alcohol, cigarettes, and of course drugs, prescription drugs or otherwise, really should not be used while breastfeeding unless, of course, if it's a prescription drug that has been approved by your doctor to use while breastfeeding. Nursing mothers, of course, plenty of vegetables because they have all those micronutrients in them. However, vegetables of the cabbage family have been considered a no-no because they can cause colicky symptoms in the breastfed babies. Other foods that seem to have a bad reputation would be like peanut butter, chocolate, egg whites, nuts. They many times have been accused of causing problems in an infant. Of course, removing these from your diet, you should really be consulting with a dietitian or your doctor to find out if that is okay. Vegan women and those who do not follow good diet guidelines should be taking a B12 supplement. Those women who don't get regular sun exposure or who don't drink milk that is going to be fortified with vitamin D, they should be taking vitamin D supplements. For most nursing mothers, dietary counseling is the preferred way to address the right nutrition while breastfeeding. So knowing that you're eating well and that you're eating the right foods is going to be very, very important to having that healthy baby. The many benefits of breastfeeding don't mean that bottle feeding is actually harmful. So formula, when it's prepared in sanitary conditions, can generally provide the same benefits of breast milk. Nutritionally, formula can be just as good as breast milk, but it does not protect infants from disease. And infants are often prone to develop allergies from formula. But bottle feeding does have advantages. So mom and family members can still participate in feeding this baby. Long-term longitudinal studies find that breastfed and bottle-fed babies are similar in physical and psychological development. Women in industrialized countries can choose either method knowing that the baby's going to be fine. So it's very important because the reason we talk about industrialized countries is because in industrialized countries, many times mom is already going back to work. So categories of childhood. We have toddlers who are 1 to 3 years of age, preschoolers 4 to 6, and school-age children around 6 to 12 years of age. So children need a varying number of calories from preschool, elementary school into adolescence because of growth and development. So more important is the fact that they need to be healthy, balanced calories. So they have to have this healthy, balanced diet, and they get all of the major food groups in that diet, and they're getting all of their appropriate amounts of micronutrients as well. A healthy diet is not only drawing from major food groups, but you have to remember we want children to avoid too much sugar, and we don't want them to have all those trans fats in their diet. So energy and proteins, the recommended daily allowance for children, 1 to 3, about 102 kilocalories per kilogram of body weight, and that's about 1,300 calories per day, and they're getting about 1.2 grams per kilogram body weight of proteins, which is about 16 grams per day. Going at 4 to 6 years of age, we're looking at 90 kcals per kilogram, or that's about 1,800 calories per day, and 24 grams of protein per day. 7 to 10, we're looking at about 2,000 calories a day, which is the same as about 28 grams of protein per day. Or, excuse me, not the same as, but would include 28 grams of protein per day. On average, a 1-year-old child needs about 1,000 to 1,300 calories a day, and this energy requirement doubles, as you can see, around the age of 10. Many children are iron deficient. The recommended daily allowance for ages 1 to 3 is approximately 7 milligrams, and for ages 4 to 8 is around 10 milligrams. So making sure children have enough iron in their diet is very important. And because children have a tendency to consume a lot of milk, this actually can contribute to low iron intake. So milk, you don't want them to be drinking more than about 3 or 4 cups per day. That also means that you need to make sure that children are not deficient in other micronutrients like zinc and then vitamin D and E. Children who are on low-fat diets, especially if they're on low-fat dairy products, they may even have more issues as far as vitamin D is concerned because, of course, in the American diet, we fortify our diets with vitamin D, our milk products with vitamin D. So having low fat, low amounts of milk products, we don't typically have as much vitamin D in the diet. So influences on childhood food habits and intake. Toddlers, their food habits are usually temporary. So if you've ever tried to feed a little baby, sometimes they absolutely love carrots, but they hate that broccoli. But that doesn't mean that that's what they're going to grow up to love or hate. The idea is you want to make sure that you're feeding this child nutrient foods, and as they grow, they're going to develop good habits. So you want to make sure that you're showing the child that eating carrots is great and keeping that sugar intake at zero or very low through this time of life is very important so that they can develop those food habits that are good for them. And caregivers, of course, they have that massive role in developing the child's health and nutrition habits. And of course, you want to make sure that all the food is prepared in safe and sanitary environments. And the child should not be responsible for what they eat or when they eat or how much they eat. And I have experienced this with parents where if the child doesn't want to eat something, then they never feed that to the child again. Or the child is in charge of telling the parent what time breakfast, lunch, and dinner is instead of vice versa. And that's not healthy for the child because they don't know what's right for them. It's very important that the parent knows that the child may be grumpy and grouchy and they don't want to eat something, but that's not going to be all the time every day. And you have to learn to work with the child and to teach them good habits. And one other thing that's really important to know is eating while watching television is not building good nutrient habits. And it shows that you're more likely to eat more and you're more likely to eat foods that are not good for you if you're sitting, eating, watching television all at the same time. So nutritional concerns of childhood, of course, we don't want children to go hungry. Although remember, a child having hunger pains and wanting to eat is healthy. So making sure that the child really does want to eat and need to eat is important too, and not having this habit of just continuously feeding the child to make them happy. Making sure there aren't malnutrition and micronutrient issues. No deficiencies in vitamins, of course, is important, because these deficiencies are going to stunt the baby's growth, and they're not going to be able to develop cognitively appropriately. They may have illnesses because of bad nutrition. And of course, if they don't have enough vitamin A, there's a possibility of permanent blindness. So food and behavior, these go hand in hand. And like, for instance, if you give a baby a caffeine drink or a soft drink, and I shouldn't say a baby, although some people do, they give these soft drinks in babies' bottles, or they give Kool-Aid in bottles, and this is not a healthy thing to do. You especially see these parents who they give this to the child, and then they don't understand why the child is, bouncing off the walls like a ping pong ball, and the child can't concentrate, and it interferes with their ability to sleep, and they become hyperactive. And this is not because of the child, but because of the foods that they're giving their child. So for instance, one mother talked to me one time about her child who was 2 years of age, and she really was trying to work with the child to stop wetting the bed. But then one of the things she told me is that she gave her child iced tea in a bottle to go to bed with. Well, number one, the tea is going to have a lot of caffeine in it, and that keeps your child up. And number two, that caffeine also interferes and suppresses antidiuretic hormone. And antidiuretic hormone is a hormone that's supposed to go up at night that prevents all of us from wetting our bed. And so you don't want to introduce caffeine prior to going to sleep, because it makes it very difficult to prevent that child from wetting their bed. Attention deficit hyperactivity disorder, there's no proof that ADHD is associated with sugar, although if you give a kid a whole bunch of sugar, they sure look like they have ADHD. I have a grandson, you give him a little bit of sugar, he is so sensitive to that. Within about 20 minutes, he's acting like he has lost his mind. And so we have to really limit how much sugar he intakes. Food preservatives and food coloring may enhance hyperactive behavior in some people, but again, that does not necessarily mean that the child has ADHD. Now, childhood obesity is a huge issue in the United States and in a lot of other industrialized nations. And 32% of children between the ages of 2 to 19 years of age are overweight or obese in the United States. And programs designed to treat childhood obesity are growing everywhere in this country. And what they're doing is they're trying to teach behavioral modification. And really what that means is they're trying to teach these kids not to eat a bunch of junk food. Now, I don't care who you are. I don't care if you're a child. I don't care if you're 60 years old. If you're sitting around all day watching television or playing video games or even reading a book, and you're not doing anything but eating, and that eating, it could even be quasi good and healthy eating, but just sitting around all day is going to cause you to gain weight. And if you think about kids nowadays, the majority of them are getting up in the morning and they're watching television or they're playing video games as soon as they can. They're eating this unhealthy cereal. They go to school, but there's not a lot of physical activity at school anymore, if there is any type of physical activity. And then they come home, Parents don't allow them to go outside. They stay in the house all day long. They munch on junk food and they play video games. And people wonder why children have obesity issues. There has to be exercise as well. A kid isn't going to want to eat as much if they are out playing. And for a child, their exercise is play. So they have to be taught, you have to go outside, you have to run around, you have to play, and you have to eat healthy. So with infants and toddlers, there's a need for fat in their diet because this is going to help for growth of the central nervous system. It helps to protect other organs. And of course, if there's not enough fat in the diet, then you're going to have a whole bunch of disease issues. Another issue is vegetarianism, and you have to be careful as far as protein issues in that kind of diet. They do have good micronutrient consumption, typically pretty good mineral consumption, so you have a lot of calcium, iron, zinc, your B vitamins, vitamin D in this type of diet. Dramatic changes occur physically in infancy and early childhood. After a period of the body relative dormancy, another transformation occurs. That's adolescence. It begins officially with puberty, which refers to the adolescent growth spurt and sexual maturation. This transformation of puberty can lead to awkward social interactions during the initial spurt, as girls are often taller and more mature looking than boys. Maybe you can think back to those wonderful junior or middle high school days. Girls are particularly likely to be dissatisfied with their appearance and feel awkward or self-conscious. So, effects of puberty. Research has shown that early maturation can be harmful for girls. Girls who mature early often lack self-confidence, are less popular, and are more likely to be depressed and have behavior problems. These potential problems can be offset by several factors, including a supportive family. So if you have a child, a female, who is maturing early, she's developing breasts early, maybe having her menstrual cycle early, there are usually some problems with this. And so as a family, you have to be very understanding, very supportive, very involved with the child's life, and especially making sure that she has outlets where she can talk about what's going on. Which is a boy or a girl? How would you know? Just by looking at this picture. Can't really tell. So you don't necessarily know when the child is young. What are the common ways to tell the gender of a small child? We'll put pink on a girl, blue on a boy. Now try again. Which is the boy? Which is the girl? I think that's pretty easy to tell. Not only does the concept of average growth and development vary by generation, but also by nation. Average and normal are not the same. This applies not only to physical development, but to all aspects of development. Puberty produces changes in physical appearance that make it easy to distinguish a boy from a girl. This is what we call those secondary sex characteristics. So being able to tell outwardly, are we looking at a boy? Are we looking at a girl? So when does the most development occur? So if you're looking at this picture in the darker kind of purplish color, these are boys versus girls. This is the average inches grown per year and age in years. So you can see that the first year you have a lot of growth that is occurring, and then it kind of falls off, and then around puberty you get that spike in that growth again, and then it falls off again. And then this is the average pounds gained per year, and again at a young age it's quite a bit, and then you only get a little bit of growth during those early childhood years, but from around the age of 10 on you're going to get a big spike in the number of pounds that you put on, and then it decreases after around the age of 12, 14 years of age. You don't put on as many pounds per year. So sexual maturation includes a change in your primary sex characteristics, which these are your internal reproductive organs. And those would include, for instance, the ovaries, the uterus, the vagina for the girl. And then for the boys, we're looking at the scrotum, the testes, and the penis. Physical changes are going to be your secondary sexual characteristics, which are the physical signs of maturity, and this is outward changes in maturity. And this is what can outwardly distinguish male from female. So girls, this would include breast development, widening of the pelvis, voice changes, and then menarche, which is that menstrual cycle. For boys, this is development of the sperm, which we call spermachy, and then the voice deepens, shoulders broaden, he gets facial hair, bigger muscles. The development of facial and body hair, such as pubic hair, does occur for both genders, but for boys, we're going to have more than for females. So adolescence is all about physical growth and development. And for boys, they're going to increase in lean body mass, much more muscle. And for girls, they're going to increase in body fat. So it's normal for a girl to jiggle. Changes in emotional maturity are also going to occur during this time, psychological developments, and of course, this is going to affect food choices, eating habits, and very much body images. Adolescents are going to need a lot of calories. So lots of energy needed during this time of growth, and of course protein is a big part of this. The highest total calories and protein grams per day than any other time of life except during pregnancy and lactation. Vitamins and minerals are necessary at high quantities during this time. And there's a lot of nutrient concerns because adolescents don't eat well. And so they need to make sure that they are eating as well as you possibly can. So nutrient needs for adolescents, growth, not age, should be the ultimate indicator of nutrient needs. So for instance, I have a brother who is about 15 years younger than I am, and I can remember when he was in his adolescence, he was growing, and eventually he hit 6'2", and he had a friend who eventually hit 6'5", and I can remember the two of them being able to consume together more than our entire family could consume together. They were growing and they were eating a lot of food. So energy needs are greater during adolescence than that time in life, except for, of course, we said pregnancy and lactation. And for males, between the ages of 11 to 14, they need about 2,500 calories per day. and that would include 45 grams of protein per day. Between 15 to 18, 3,000 calories per day, and that includes about 59 grams of protein per day. For females, 11 to 14, we're looking about 2,200 calories with, again, around 46 grams of protein per day. 15 to 18, still about 2,200 calories and still about the same amount of grams of protein per day. So, influence of adolescent food intake. Can you think of different influences in their lives? And I think peer pressure, television, all those things, of course, family, are going to be huge influences on what they eat. So, school cafeteria, vending machines, sports drinks, sodas, fast food, these are all influences. So, nutrition-related concerns, of course, sports and fitness, they need to have a lot of exercise going on during this time and establish good habits of nutrition and exercise. Of course, acne is an issue for adolescents, and we don't know exactly how the connection is between diet and acne, although it does appear that higher fatty foods and sugary foods are contributing to some acne issues. Eating disorders become a big problem during adolescence. Obesity, of course, and a lot of this has started in childhood and it continues to develop. And because of this ongoing obesity, you have high blood pressure problems, you have high glucose problems, and already in children as young as 10, 12 years of age, we're developing type 2 diabetes. You know, at one time we had two different kinds of diabetes. We used to call it juvenile diabetes and adult onset diabetes, but now we're calling it type 1 and type 2 because the adult onset diabetes, which is typically caused by bad eating habits, is now starting in children. And of course, this obesity also creates other issues, breathing problems, joint pain, heartburn, and then of course you can imagine the psychological issues in this individual who is so young and so unhealthy and so overweight. Of course, during adolescence, these children have now grown up. They don't have as much adult supervision. They're out on their own more. They're able to start to experiment with things. So, tobacco, alcohol, recreational drugs, and of course, these things take priority over food. And the teenager or the adolescent now they eat even worse than they did before. And teens who use drugs are usually underweight and they report poor appetites. So, pregnancy. This is a time, obviously, of a lot of change in the body. Hormones are up and down and all over the place. And of course, these changes include growth of the uterus and the breasts, way more fat tissue on the body, what we call adipose. There's an increase in blood volume. Gastrointestinal motility slows down. All these changes have nutritional and dietary implications for pregnant women. So, weight gain during pregnancy is a combination of fetal and maternal tissues and fluids, and the weight gain recommendations are based on your BMI prior to pregnancy. But on average, you're talking about a suggested weight gain of about 25 pounds. Women of normal weight, again, should not gain more than 25 to maybe 35 pounds over that 9 months of gestation. So, risk assessment, okay, as far as pregnancy is concerned, is you're going to look at the age, the diet the person already has, whether they're consuming certain types of substances, are they on certain medications, are they taking illicit drugs, do they have existing medical conditions. All of these are things that you look at as far as the nutrition of the individual. And are their nutrition levels going to be now appropriate for the fetus that they're going to be carrying? And then, of course, you want to promote a healthy diet and to refrain from particular substances that are not going to be compatible with the life of the fetus. So intervention may have to happen, referrals to hospitals, and making sure that the hospital that the person is referred to has the right equipment, the right trained staff, and so on. For instance, you might have a woman who is already obese and she becomes pregnant and she's not eating well, and while she's pregnant, she gets gestational diabetes as well. Now you have to have a different set of staff to take care of someone who has these potential issues, and now the fetus may also have potential issues. So for instance, one of the issues that can happen when a mom has gestational diabetes is that potentially the fetus can get very large, and so you have to monitor the size of the fetus to make sure that mom is able to deliver naturally, or if mom needs a C-section to occur. And then, of course, nutritional counseling is very important during pregnancy, which I think is really interesting because very seldom are women sent to any kind of nutritional counseling. As a matter of fact, nutritional counseling is just not given enough, period, to anyone for anything. I have a daughter who has a problem called PCOS, which is polycystic ovarian syndrome. And one of the issues with that is that it is very difficult to become pregnant. And nutritionally, we eventually found out that making sure that she has an extremely low carbohydrate diet is the thing for her to be able to become pregnant. And sure enough, when she went on this strict low carbohydrate diet, she was able to become pregnant and delivered her first child at the age of 40 naturally. And he is now 7 months old and doing very, very well. And of course, so is mom. And they're planning on their second child now, even though it's kind of later in life. And so certain nutrition is going to be necessary to be able to help the woman to become pregnant or to be able to maintain that pregnancy and then carry that pregnancy to a healthy finish. So a pregnant woman requires more calories for that baby to be able to grow so she can maintain that developing fetus, plus the placenta, plus she's going to have increased breast tissue and fat storage. And then growth and development of the fetus requires carbohydrates and fat as an energy source, okay, as well as proteins. Vitamins and minerals are going to be also needed, and all of these are going to be needed in higher quantities to help for cellular growth and differentiation. So when you're looking at the non-pregnant versus the pregnant woman, typically, first of all, calories are going to increase, and you're going to see all other sorts of things increasing, like protein production, or protein consumption, vitamin A, vitamin D around the same during pregnancy, vitamin E around the same, K, thiamine a little bit higher because your B vitamins need to go up for that energy production, niacin, vitamin B6, folate, of course, definitely needs to go up, vitamin B12, choline, vitamin C, calcium can stay around the same, phosphorus, magnesium, iron, zinc, iodine, and copper levels. So we've talked about this before, but folic acid supplementation is necessary in order for neural tube growth to be normal so that the child doesn't end up with a neural tube defect such as spina bifida. Excess intake of some vitamins like A and the use of drugs increase the risk of poor pregnancy outcome. Energy, the recommended daily increase is about 300 calories per day for the second and third trimester. Now, of course, some women think, oh, well, I'm pregnant, so this means I'm allowed to eat a whole bunch more every day, and they give themselves the leeway to drink a bunch of milkshakes and eat hamburgers and have a good time. But notice that's only 300 calories per day. That's not a tremendous amount of calories to be able to consume. And of course, we talked about protein needs to go up, and the diet should contain carbohydrates and fats in the same proportion as recommended for non-pregnant women, depending on what that recommendation is. Pregnant women who consume enough energy through a healthy diet should be able to meet all the nutrient needs of this pregnancy, except they will have to increase iron and folate. So as a person ages, weight and body composition is going to change. Typically, we see an increase in the amount of fat on the body, and the person loses lean body mass. Now, that's usually because, if you think about this, as you become an adult, the older you get, more responsibilities you have, the more you're working, the less you're exercising. And that doesn't mean that you have to lose that lean body mass or add all of that fat, but it's pretty normal that that occurs. I don't know if you've looked at some of these YouTube videos or online, and you can see a lot of people, they're 80, 85 years old. I even saw somebody 100 who, they're running in races and they're exercising and their lean body mass is really good. Of course, overweight, because we're adding all that fat, that leads to chronic diseases, and of course that can include cardiovascular disease. Being underweight can also do that as well. And then not having the right amount of calcium. And by the way, not doing enough exercise also leads to osteoporosis. So the more anti-gravity type exercises you do, the less likely your osteoporosis. Also, the greater your lean body mass, the less likely you're going to have osteoporosis. So physical activity is very, very important to reduce your risk of disease and then, of course, improve mental health. So immunity is an issue. Our immune system declines around the age of 40 to 50 and continues to decline, and you have increased risk of infections like upper respiratory tract infections, urinary tract infections, and then, believe it or not, the sense of taste and smell decline as you get older. And because of that decline in sensitivity, people are more likely to eat sugary or high carbohydrate type meals because they may not be able to taste them, but actually they give you a kind of mental boost, and that's because they're releasing serotonin and endorphin, and they make you feel better, so you want to eat them. And it's better to serve foods with stronger flavor and odors over bland foods so that people, as they get older, are really going to want to taste those types of foods. They'll want to eat them. Gastrointestinal changes are also going to occur, and one of the reasons why we're not able to taste or smell that food so well is because we're not producing as much saliva. So that decreases our ability to digest carbs in the mouth. It decreases our ability to taste the food. We also have a reduced acid secretion in the stomach, so we don't have as good of an ability to digest food. And that could also lead to development of atrophic gastritis, and we don't have the ability to absorb vitamin B12 as well. So there's an increase ability, or how should I put this? The person is going to be more tired. Let's just put it that way. Also, a reduced gastrointestinal motility in the small intestine as well as in the stomach. So we don't have as good of gastric emptying, and our food doesn't digest as well, which also then relates to I don't have the ability to absorb all of those nutrients that I need. So nutrients needed for a mature adult, of course, we need energy, but because we're not moving as much, because typically as a mature adult, we're not exercising as much, just simply because we're working more, we don't need as many calories. So I always like to say the more you work out, the more you get to eat, okay? So physical activity increases that energy requirement. It also helps you to decrease your loss in that lean body mass. And then proteins, if you're exercising, you're going to need more protein in your diet. But you really have the same need per kilogram of body weight as a younger adult. Carbohydrates, 45 to 65% of our calories come from a carbohydrate diet. And we don't really need a high carbohydrate diet as a mature adult. Now, fiber we do need in very high concentrations because this is going to prevent constipation and prevent diverticulosis. Now, diverticulosis is where you have these kind of like pits in the walls of the large intestine. This is a picture showing you diverticulosis and those pits. So what happens is because the person doesn't have enough fiber in their diet, the feces becomes thicker and harder and more difficult to eliminate from the body. And so the individual has to apply a lot of pressure to try to get the feces out. And when they apply that pressure, it pushes on the walls of the large intestine or the colon, and that pressure actually, you might say, kind of punches holes into that colon. Now, the real issue with this is that you have a lot of bacteria in the colon also, and that bacteria now can get into this deeper pit and eventually can create an infection, and then you have what we call diverticulitis. And that diverticulitis then is not a good thing for your patient. The infection can become so bad they may have to have parts of their colon removed, or if it's not caught in time, they may become septic. Another thing is we know that fiber can reduce your risk of diabetes, and that's because let's say that you eat something that has 15 grams of sugar in it, or carbohydrates, and it also has 15 grams of fiber. So you eat this fiber and you eat these carbs at the same time. Fiber binds carbohydrates to it, and we do not digest fiber. Fiber ends up in the large intestine, in the feces, and eventually fiber is eliminated. So when fiber binds to these carbohydrates, those carbohydrates don't have the ability to then be absorbed into the bloodstream. Instead, those carbohydrates are eliminated out of the body, and so you don't get these spikes in carbohydrates in the blood. And so that can reduce our risk of diabetes. Now, by the way, one of the other things I forgot to mention is that not only can fiber attract carbohydrates, but fiber can also attract water. So that when fiber ends up in the feces in the large intestine, the good thing about it is that water is attracted to that fiber in that feces, and the feces then remains soft and is able to be eliminated very easily, and we don't develop that diverticulosis. And of course, that helps to promote a healthy body. And then also, because I'm not absorbing all of these carbs, I can have a better body weight. So some of the nutrient needs of mature adults, as far as fat is concerned, we need to have the appropriate fat consumption in our diet. Water is very important because as we get older, we actually have a reduced thirst response and dehydration can occur. And so you need to drink as many fluids as if you were a younger adult. And then, of course, vitamins are very important. So vitamin D, we need these to allow for calcium absorption and to decrease osteoporosis risk. One of the other concerns about vitamin D is that the skin ages, and because of this, we don't have the ability to synthesize and to activate the vitamin D as we did when we were younger. So consuming vitamin D is very important as you get older, and you have higher needs compared to younger adults. So you have to take more vitamin D as you age. B vitamins, number one, we have a reduced ability to absorb vitamin B12 that we already talked about. Vitamin B9, B6, B12 may help reduce risks of anemia, aging, depression, dementia. So consuming your B vitamins is very important. And then antioxidants such as those found in fruits and vegetables helps to decrease that oxidative stress, so decreases your risk of cataracts, decreases your risk of things like Alzheimer's, macular degeneration, and may protect against damage to the brain. So minerals of concern, we talked about calcium for bone health, and then zinc is important for immunity and wound healing. Iron is also very important, and the older we get, we have a decreased ability to absorb iron. So drug, and then drug-nutrient interactions. Now, a lot of people, as they age, are going to be taking more prescription drugs for different things. And so these drugs can influence the foods that we are able to absorb. So, for instance, certain herbal supplements can influence our vitamin and mineral absorptions. And so we have to be very careful of that. And certain medications can also do the same thing. And then, of course, there could be possible interactions with herbal supplements and possible interactions with different vitamins and minerals with the medications that we might be taking. Depression is a big deal as people get older. It's very common in institutionalized and low-income seniors. Because they're depressed, they may not want to eat right, and they may actually consume more alcohol. And so, of course, that interferes with nutrient consumption. Anorexia of aging. Now, because they can't smell and they can't taste, they may not want to eat. Because they are depressed, they may not want to eat. If they become ill, they may have a loss of appetite. And of course, malnutrition is an issue. Pain and swelling in joints may interfere with, number one, the ability or even the want to prepare food. And then because I'm in a lot of pain, I may not want to even eat. Then the medications that I'm taking for pain could decrease my desire to eat. And then I have to really be careful of this malnutrition again. Bowel and bladder regulation, there's an increased risk of urinary tract infections. There's an increased risk of constipation while someone ages. And again, this can be very nutritionally related. Dental health, tooth loss, difficulty swallowing, mouth pain, this all contributes to our ability to eat food or not. Vision problems, if I'm getting macular degeneration, can I shop? Can I cook? Because I can't see, I'm going blind. Osteoporosis is also a big one in the elderly, especially older women. And so this has a lot to do with I'm going to be in a lot of pain. Can I stand appropriately for the amount of time it takes me to eat or to fix the food I'm going to eat? Can I maintain my calcium and my vitamin D levels? Can I exercise? Alzheimer's disease, of course, you know, is an accumulation of plaque in certain regions of the brain, causes degeneration of neurons, and then can I eat appropriately? Can I obtain, prepare, consume a good diet? And then, of course, that does also reduce my ability to taste and to smell, and I have weight loss, malnutrition issues. So I know that you have an older person who wants their independence, but they may need community support. And so you have things like Meals on Wheels, and you have elderly nutrition programs and food stamp programs like SNAP. These are very important. And I hope you have a great break. And I look forward to seeing you in class again.